I get a call from school that he is vomiting. I said, Jude doesn't vomit. So I said, I think he might be choking. Is he choking? Can you check with the classroom? They call the classroom. The classroom says, nope, he didn't have anything in his mouth. This is I have to take care of it. I don't have a ton of time. His nurse comes out when I get there and says, we think it's part of his chew toy that is broken off. And I said, well, then yes, he's choking. They said, we are worried it's going to lodge further and then he will not breathe. We are prepping the OR. So it's a whirlwind of everything.
Welcome to A Place of Yes, a podcast about how I moved through my darkest hour. And for me, that was in channeling my grief into good. Welcome to the show. This episode is the continuation of our conversation with Jessica Troiano. When we recorded together, we spoke at such length that there was far too much content for one episode, and cutting any of it felt impossible. I am thrilled to bring you part 2 of that conversation. In the first episode, Jessica shared her journey as a rare disease mom to her son, Jude, offering an intimate look into their day-to-day life. She spoke about the overwhelming isolation many rare disease moms feel and the constant worry that comes with the relentless stress of keeping our kids alive. In part 2, we dive deeper into the complex medical realities of rare families, the struggles with doctors, the multiple diagnoses, and the surgeries, both planned and unexpected. I know many of you will relate to Jessica's experiences, and for others, it will offer a window into the challenges faced by rare disease moms. We'd also like to extend our heartfelt thanks to our sponsors, Adirondack Trust Company and Amsher Insurance, for helping us share these important stories. So in the 10 days, less than 10 days since I saw you last, when we talked about, you updated me on Jude and you said, he's been doing so well. I got a text from you a few days ago that he needed emergency surgery. That is just such an example of the lives that our kids have. So can you share that story, like kind of what happened? And I know we were saving it for this conversation, so I kind of want to know what happened. Yeah. Emergency surgery, unexpected.
Yes. And again, a great point that things turn very quickly and can be very scary and very urgent. These are not, okay, somebody fell down, hurt themselves, and broke a bone.
It's not the text I got from Ethan where he had to go get x-rays because he broke his pinky.
Jeez.
It's not that.
Different.
Life goes on, right? Like,
exactly.
And it's not even, it's more like a heavy sigh and an eye roll. It's not a clenching, there's a difference.
Of course, I think of, what if something happened to Tristan? Of course you do. You're a parent. And I do recognize the difference in me between my thoughts of what if something happens to Jude, a very real and probable thing, versus what if something happened to Tristan, which is much more, an existential.
Yes. Yep.
What would happen? That's the difference there. And it is highlighted very clearly with what happened on Friday. I get a call from school around 2 o'clock that he is vomiting. I said, Jude doesn't vomit. Like, this is not that he can't. Some kids with JG can't.
Yep.
Jude can vomit. He does not. It's been a couple times in his life. So I said, I think he might be choking. This did happen at school in June of 22. Very similar. He was vomiting. They called me. They actually knew he was choking at that time. He gets sent to Albany Med. The doctor examines him. They were able to pull it out. Fast forward to Friday. I get the call. He's vomiting. I said, I don't think so. Is he choking? Can you check with the classroom? They call the classroom. The classroom says, nope, he didn't have anything in his mouth. And I said, okay, well, regardless, right? This is I have to take care of it. I don't have a ton of time. I'm going to get in the car. I'm going to come. Now, I didn't feel comfortable driving alone while Jude is vomiting, potentially in the back, and I have to suction him. My mom comes very quickly over. She comes with me. His nurse comes out when I get there and says, we think it's part of his chew toy that is broken off. And I said, well, then yes, he's choking. So they're like, there is a little bit of blood in the vomit. And I said, well, then he's definitely choking. Yeah. I am. I can, in an emergency situation, I am very calm. Yeah. I don't know how. I don't know why. I don't know how, but it does change. And I'm able to say things much clearer, think very clearly. Afterwards, whoa,
Different
it's
story.
a different story.
Yeah.
But right now, I'm there. I said, okay, we need to call 911. We need to go to Albany Med. Let's get them on board. EMS gets there. There's like 6 guys there. They're taking his blood pressure. It's 70/40, so very low. I'm saying like, okay, now we have to get him going. And I said, he's also sliding down in his wheelchair. I start lifting him up, and one of the guys says, well, we'll get him on the stretcher. So I just pick him up and carry him to the stretcher. Let's go. Yeah. Actually, the ride to the hospital was absolutely crazy because inside the ambulance, all of the doors are opening and closing. Things are falling out. The emesis bags, they're saying, don't worry about that. I'm like, I wasn't going to worry about that.
I've had that experience, and I don't understand it.
I don't get it either. We get to the hospital, and it does take about an hour and a half before they start recognizing and realizing that I know what I'm talking about. I had the chew toy with me, so I could show them. I mean, he is vomiting every minute. Really, every minute. And it is brown, and it is thick, and it's coming out his nose, and I'm suctioning him as best I can. We are waiting for an x-ray. They bring us down to the x-ray. No suction, no oxygen. I'm there in a hallway alone with him. We get the x-rays done. Eventually, we get back to the room, and eventually they say, this is on top of his airway. He is breathing still. And I think that was the big thing, is that his O2 levels were okay. Jude compensates a lot. I think he was working really hard to get every breath in. They said, we are worried it's going to lodge further, and then he will not breathe. We are prepping the OR. So it's a whirlwind of everything. They get him down. I'm following them, and half the team is stopped, half the team is with him leaving. I'm standing in the middle. Where do I go? They're like, well, that's the OR. You can't be here. I said, you said to follow. I'm going to follow.
Yes, I can. Yeah.
I end up waiting, and eventually it was easily resolved. Thank God. They scoped the nose. They went, saw it right at the top, were able to extract it. No problem. The problem being that he should not have gone through that.
On so many different levels.
He works so hard every day just to do daily tasks, daily things that we take for granted a lot as very able-bodied people. Yeah. And going through an emergency surgery is not one of them. The scarier thing, and when I was texting you as well, it was also like we did not know what was happening. They were talking about, okay, well, we might have to do an incision. If we have to do a trach for emergency life-saving, would you need that? Would you want that? Trying to make these decisions very quickly on your own is not something that you would have to do normally, right? Like these are not things that parents think about, that people on a daily basis have to worry about. And these are things I worry about all the time.
And most people don't have to worry about them at any part in their life, right? Like if you get yourself in that situation where you're worried about it, it's something tragic, rare, quickly, random has happened. It is not an ongoing thought or concern or experience.
Like a one and done, right?
Yes.
Okay, I choked on some meat. It's out.
Yep.
Good. It is every day. I mean, for a long time, I kept a hospital bag packed because I was like, I can't do this every time we're going to the ER. Yeah. And because Jude is so unique as well, when we get in, we're keeping him. We're going to, resident is going to see him. Everyone's going to test him. Everyone's going to look at him. Everyone's going to get information from you. I am happy to give information. I am happy to talk about Jude with medical professionals all day long. I could. When it's constant poking, prodding, waking him up, when he needs the rest, when he is in a stable position, like that's where I sort of have more of a hard time dealing with everybody.
So several times in that story, I almost had like out of body because I know exactly that feeling. And then you just touched on it. One of the hardest things I think about this life is not taking care of our kids and is not our life with our kids, but it is that when we have to educate doctors and people who should know better, and we have to do it vigilantly. You don't have the privilege to stress out and worry about your kid in that situation because taking your eye off the ball, you could lose them. Mm-hmm. Because our hospitals are not equipped for our children. As much on us to keep them alive, even in the hospital setting, as it is on the doctors. So that feeling of having to educate, and then everyone wants to see, and everyone thinks it's the worst. And, I've never seen this before. I've never seen this before. That I used to find harder sometimes than the actual reason you're there.
Yes. I agree. I will say his providers that we have, the specialists, I mean, we go mostly to Boston Children's Hospital, just because that seems to be the right place for Jude. It's the emergency stuff, of course, a seizure where he's not breathing, O2's going way down. We need to get somewhere quick. We're going to Albany Med. And in general, I have had good experiences, but it's interesting because the good experiences are mostly because the attendings there are saying to me, I'm deferring to you.
And that's what I would always say. I respected, and I mean, who am I, right? But the good doctors had no ego and can say, hey, I have not seen a kid like this, but this mom knows what they're talking about, and let's work together. And what do you think I need to do? And they have the ability to do it. If we had the ability to do it, then we wouldn't even be there. The ones who want to tell you they're the doctor.
Yes.
That's where it gets hard, right? And I think you're right on. We, at one point with Jake, we don't ever quite know why this happened, but he was on so many meds. His bones were really weak. He had that osteopenia, and he broke his femur laying in bed. It was one of the few times he screamed bloody murder. They did an x-ray. He had a broken femur and said it, do what you need to do. We're going to Boston. And they're like, you can't take this kid to Boston. It was like, the hell, watch us.
Yeah,
and we did. And we took him to Boston. At that point, his orthopedic surgeon was at Mass General. He was going through the ER. When I'm done with my day, I'll come in and do this program. It was just the exceptional doctors who have no ego and just do it. But for us, we did not trust that our local hospital would know how to keep him alive through that surgery. That is another level of this. So you're not only dealing with the choking and this, but you're on pause while you're waiting for people to catch up and figure out.
And there's a couple things I was thinking of as you were telling me that. But the first was, again, yes, absolutely. On Friday, I remember one of the doctors looking and saying, well, he's 13. He'll probably just swallow this and we'll pass. No. And now I'm like, okay, I'm going to
now I got it. Yeah.
Jude.
Now I got to step up. Yeah.
Did you read his chart? Because I'm going to tell you his chart. Yeah. Oh, he had a spinal fusion 3 years ago. So from the occiput to C3, we have this. And they're hooks because the screws don't fit because they're too small. And he's looking at me, and I'm like, oh, you poor thing.
Yeah.
Oh.
Buckle up.
Are you ready? This is where we're going. And then it was, okay, we're going. We're going to get him. Just get him in. And so there's that. Yes, absolutely. Yeah. There are the doctors that do think, okay, well, this is a typical child would do this and kind of don't see the needs, which sometimes I could appreciate in a different circumstance.
But at that point, you're like, what is happening?
I'm like, I'm at a doctor's, I'm in a hospital for you to help.
Yeah.
Most of the time, I really advocate for Jude to be home. Because I'm like, I have oxygen, I have a suction. I got trained in how to do deep suctioning even, which is something normally parents don't do at home.
Most parents, I don't think, know what suctioning is.
No, I don't think anybody
maybe we
does.
Can. No. I'm like, oh, that's totally normal.
Yeah.
But no, so suctioning, right, they used to be the little bucket, and I always hated how hard it's you turn it on, it's like that is my impersonation of a suction machine. And then, but you stick it in, and you got to be careful not to gag them and make them puke, and sometimes you do. Yeah. But you get
too far.
Yeah, you go too far. But look with Jake, he couldn't always if he had a cold or he had anything congestion, he couldn't clear it. He couldn't. He didn't have a strong cough to just move it. So you had to get it out for him.
Yes, and that's what when we first got it, it was Jude's cough was not strong enough, and we had a cough assist machine, which would you would put a mask on.
See, we never had one of those,
and it would push the air in and then pull it out. Absolutely, torture device type things.
Sounds horrible. Yeah.
They were you can try it just to know, and they're but do the minimum setting, and they're but Jude would get this, and I'm like, oh dear. Yeah. We have the vest. Which goes around and shakes, the percussive vest. Yeah. Jude adores it. Most of the time when we're suctioning, it's just well, he can't blow his nose. Yeah. We can't say, you're stuffed up, bud.
Yeah.
So
you got to get it out for him.
It's that old, I know new moms have, the nose Frida thing that is absolutely disgusting to me, but I know they use it, and they just suck out the boogies. That's the same thing. But the suction is great. It works well.
I took us down the suction journey. The point being that, and I was the same way with Jake, right? You want to keep them home
Yeah.
Because yes, sometimes you need to be at the hospital, but sickness is at the hospital, right? And I at least was always worried, like an ear infection could be what kills my kid.
Right.
Because it's a slippery slope. So you got to it's that balance of like, you want him to go to school and you need him to get what he needs, but you also need to protect him in a different way.
Well, I also think a lot of times my experience has been, because I am the one that stays home or stays with Jude, and Alex really stays home with Tristan. That's typically our dynamic of how that works.
Yeah.
And when I am there, I see a lot of the times that it is me in a room with Jude. So I'm taking care of him anyway.
Yeah.
But I have no other supports. I can't call my husband in to help me change a diaper.
Yeah.
I can't.
You're not comfortable.
You're not in sleep. I can't.
Yeah.
I'm alert, eyes on him all the time. I don't want him in the hospital if we don't need to, for many reasons. I do not want him in there because I do not want the germs and the other things that go along with it. And I also don't want him in because I know that I can have better eyes on him at home. And unless he is having a true emergency where we need to be in there for a while, we have been lucky enough that our providers that we have are phenomenal. Boston's excellent. He was actually born with cataracts, so we did cataract surgery.
Was that the first surgery?
The very first was the G-tube.
Oh, the G-tube. You said that. Yep.
At 6 days old, the next surgery was the eye surgery. So he had the cataract surgery at a year old.
At a year. That sounds
like Benjamin Button.
I was going to say, isn't that's a little backwards?
Yeah, kind of went backwards in that. But he had that done. They put lenses in. I was like, okay with that. Sure, okay. He doesn't have great vision. That's okay. I'm here in his face. I don't need to worry about that. The news that he was deaf and not hearing, I broke down. I just had a hard time with that. I think that's actually the only thing that I've really had a hard time with, aside, I will qualify that as aside from his spinal fusion. That was a much harder story. That was a much harder build up to it. But yeah, his deafness was difficult to process. Now I don't even think of it really. I mean, we talk to him, we laugh with him. He clearly loves music. He gets music therapy. And again, in how I respond to things, it was, okay, well, now what do we do? And I make a very clear point with doctors, like, just because you can do it doesn't mean you should.
But it's
For real. I mean, there's so many different surgeries that could be done to fix Jude.
Yeah.
And no, most of them we shouldn't even consider.
No.
The things we should consider, I remember seeing neurosurgery here at Albany Med, and the doctor there was very good and said, at the time, it was actually the neck was caught because of an x-ray of his chest. And they said, well, there's a bit of an anomaly in his neck. We need to go get that pursued further. And so they took more x-rays of that. And we saw neurosurgery because the vertebrae are supposed to be circles that are connected and go straight down, right? And you have your spinal cord in between with the dens so that everything stays in place and doesn't touch. If you touch, you're paralyzed. And Jude's was not formed properly. So at the occiput, so that you have your skull and you have the base of the skull and has the spine, beginning of the spine, and his was open. And because it was open, it couldn't be supported straight. Jude's neck was always tilted. And it was just anatomically how Jude was born. That's just there. And what was happening is it was compressing a spinal cord. And they said it's about halfway of what we normally would have. And if that dens touches at all from the neck down, he would be paralyzed, and most likely what would really happen, because parts of your spine control different things in your body. The top is the breathing, and they said he would just not be able to breathe, and it would be an agonizing, slow thing to have happen. To hear that, I don't even know if I have words for that. I do know that the doctor said I would not do it here. He would probably have a stroke on the table and not make it. We did not do anything for years because I heard from a very respected, and I totally appreciated that he was like, I don't feel comfortable doing this, and I don't think you should right now, that Jude would not make it. As the years went on, we would get this looked at, and it got worse to a point where they said, you have to do it because it will happen. Well, how do you make a choice? When there's no choice, how do you make a choice, Okay, well, we have to do this. Well, we went to CHOP in Philadelphia and had a second opinion there, and Boston and talked and went back and forth. I liked both of those are phenomenal places to
can't
go.
go wrong.
You can't. Actually, oddly, I was told originally Utah was the best place to go, to Salt Lake City. I said, well, I'm not doing that. Why they ended up in Salt Lake City, I feel like that's a missed opportunity. Comes closer to one coast or the other.
Yeah,
but
random.
Very random. And I said, that's just not that can't happen.
Well, that's like it's a different kind.
So many different things with it. I said, I'm not going to do that.
Yeah.
So I can do Philadelphia. I can do Boston. I could do New York if I needed, but that actually was off the table. Like that wasn't the place to go.
To do it?
We chose Boston in the end. It did get pushed because, of course, it was supposed to be right at the beginning of COVID, and the protocols were not in place. Like they were like, we can't do this yet. This is too big a surgery to just do while we're figuring all this out.
I mean, how hard, right? You finally come to terms with what you need to do, and then we are in a global pandemic.
I know.
Lord.
So we ended up waiting. He had the spinal fusion done there in March of 21.
Okay. So a year later than...
A year later, which was scary because everything was like, don't jostle Jude. And he's a maniac. Like you put him on your lap and he rocks out. And I'm like, don't do that. Just stay still. Don't jar this area. He could care less. He thinks
not
this is the
listening.
best.
Yeah.
I remember talking with his pediatrician and going in, and of course, it is during COVID when I'm having this, and I'm sobbing. The spinal fusion, the anomalies we saw there it's very different, and I'm like, well, I don't want to do this, but this is truly a life-saving thing, and I don't truly have a choice.
Well, it's hard because you're choosing between, because the thing with these surgeries, it's timing. It's doing the surgeries when it's the right moment in their sort of health journey too, right? Because they gotta go in strong. Like they gotta go in, I don't know, I remember when Jake had he had a double hip surgery and I was like, I need him to go in a little chubby because he's gonna lose weight. Like, you know what I mean? Like he's gotta have reserves because he lived most of his life with not a ton of reserves. There are these scary surgeries that you're nervous about because it's not just the actual surgery. It's surgery, but it's the recovery, all of the factors. But then when you're faced with, if I don't do this, I'm making this other decision.
In my opinion, it was just there's no choice.
There's no choice. I mean, I like what you said, though. Like, how do you make a choice when there is no choice? You know, I mean, that's a lot of the things you have to do.
That's what I think really our life is. This is what we have. This is what we have to deal with. This is how we move forward with this. And some of it we can kind of choose a path, but most of it is just, well, this is what has to happen. I feel lucky that I have had the providers that I've had that I've been able to just sit and talk with if I need to.
You know, and we've talked about them a lot, but there is something so special about the relationships you form with some of these really spectacular, extraordinary doctors who we are blessed to come in contact with, you know, and Jake certainly had some, and they fight alongside you.
Yes.
And that's so important. There are so many more things I feel like we could talk about.
I could talk forever, so...
Well, you know what that means. It's time for Ask Heather Anything.
Okay.
We always end the show with the opportunity for the guest to ask me anything. And some people take it as an opportunity to ask me something really silly, like what's your favorite karaoke song or something. And other times people go kind of deep.
How did your relationship with Brian change over the years?
So I think different than your story, we had a healthy baby for the first 8 months. And that, honestly, I think any issues we had in our relationship was just very typical. It was 2 young kids, not sleeping great, like all of that, just a blur. Like more that there weren't issues, it was just like that when your life's a blur. Then Jake got sick and we each had kind of our roles. When he first got sick, we didn't really know he was sick. In the beginning, we really thought, like I was like, oh, it was a Saturday night. And I was like, oh, we had concert tickets on a Tuesday. I was like, you think we're going to make it to the concert? Like I had no idea.
Yes.
And I think then we were almost constantly just playing catch up to our life a little bit because we didn't have a diagnosis. We didn't have any names for anything. The genetic tests didn't give us any answers. So we just were flying by the seat of our pants, and it kind of worked for us. Similar to some of the things you say, we just really tried to focus on giving both kids a good life and doing the best. And sometimes that meant Brian was doing more with Ethan, and I was really involved in Jake's day-to-day, and I stayed home, and some of the things like that was really my job. After he passed, I don't have a concrete answer for that, but we became closer. I think it tears apart a lot of families, and I don't think I have a great answer of like how we managed to stay together, but it certainly brought us closer. At the end of the day, we have gone through some things that are really, really hard. Kind of like you mentioned, there's not a lot of people who understand the lives that happen and the struggles and the fears and all of that. And it has brought us closer because we cling to that. It's nice to not always have to explain yourself. Our relationship became so much deeper because we were fighting for our son's life. And there's just something so heavy with that, but also beautiful. Right? There's something about that life that's really, you know what's important and you know what's not important. And sometimes there's jealousy and you wish you could do more things and you wish you could get to California easily and you wish you could do those things. But at the end of the day, you're fighting for the same thing. And I think that for couples, when they can unite with that and support each other, then I think that's makes the difference. And I think marriage is hard. And I think you add some of the stuff and it's harder. But if you kind of keep your eye on the job, I don't know, for us, it's kind of worked.
Yeah, just wanted to kind of hear your side of this, going through it for so long.
I feel like you can either push everybody away or you can cling to the people who get you.
And I do feel most people it's an extreme, right?
Yeah.
It's either, okay, well, this is it, we're done.
It's either you are reminding me of all things that I can't, or you are, and I think we have, not always perfectly, but we have realized we're in the fight together. And here we just had 20 years. Thank you so much, Jess, for being on the show. I have really enjoyed this conversation. I'm just grateful. Thank you.
Thank you so much. Really, I have had so much fun. I was so excited to do it. I feel like I could talk for days. So
maybe we'll have a part two sometime.
I really appreciate you having me on here and getting to share a little part of my story.
Thank you. I want to thank Adirondack Trust Company and Amshire Insurance for sponsoring this episode. If you really like this episode, please share it with a friend. It would make a world of difference if we could just reach more people and share the work that we do and the stories we want to tell. Thank you so much for watching.